Hi, welcome to the 2026 Medicare Supplement, Medigap. Basics Explained. In this session you will learn: what are Medicare Supplement or Medigap plans? What out-of-pocket costs are not covered by original Medicare Part A, hospital insurance, and Part B, medical insurance? How do Medigap plans work? What are the differences between the standardized policies, referred to as plans A through N? When can you buy a Medigap insurance policy? What is medical underwriting and what health questions can they ask? What are guaranteed issue rights and when can you use them? How are Medigap plan premiums set? What other factors affect Medigap premiums? And finally, what other features do some Medigap policies offer? So, what is a Medicare Supplement or Medigap plan? They are private insurance policies sold by private insurance companies, approved by Medicare, and approved in each state in which they are offered. They are not medical plans. They don't have networks of hospitals or doctors. Medigap plans are exactly what they say they are. They cover the gap, that is the out-of-pocket costs that Medicare Part A and Part B don't cover, such as deductibles, co-pays, and coinsurance. They don't include prescription drug coverage. It pays only for Medicare-approved services. A single Medigap plan is an individual insurance policy. It only covers one person. Medigap policies don't work with other types of health coverage, such as Medicare Advantage plans, employer or union group health plans, Medicaid, or TRICARE. An insurance company can't cancel your Medigap policy as long as you stay enrolled and pay premiums. So, what costs are not covered by Medicare Part A, hospital insurance, and Part B, medical insurance? First, Medicare Part A hospital insurance does not cover all costs. In 2026, you are responsible for the out-of-pocket costs as listed here. It starts with the $1,736 deductible when you are admitted as inpatient into the hospital for days 1 through 60. Medicare Part A does not pay if you are admitted only for observation. So, it's important that when you are admitted into the hospital, you are admitted as inpatient. In addition, Medicare Part A covers the first 20 days of skilled nursing care at no cost to you. Remember that Medicare Part A hospital insurance is not based on an annual calendar year deductible. It uses what is referred to as a benefit period. A benefit period begins on the first day you receive service as an inpatient, and ends after you have been out of the hospital and have not received skilled care in any other facility for 60 days in a row. So, if you are admitted as an inpatient after that time, a new benefit period begins with a new Medicare Part A deductible, even if it's for the same medical condition. Next, let's take a look at the out-of-pocket costs associated with Medicare Part B medical insurance, as shown here. In 2026, Medicare Part B starts with an annual deductible of $283. After that, it covers 80% of physician services, outpatient care, tests, and supplies. You are responsible for the remaining 20%. In addition, you are responsible for all excess doctor charges, that is, all charges above the Medicare-approved amounts. To learn more about what Medicare-approved services are covered, go to the Medicare.gov website, or download the Medicare What's Covered app. So, let's look at an example of how a Medigap insurance policy works. Here, Dr. Jones works for a hospital that accepts Medicare assignment. It's an agreement between healthcare providers and Medicare, where providers accept Medicare-approved amounts as full payment, preventing them from charging you extra. This benefits you by controlling your costs and ensuring you only pay Medicare deductibles and copays. First, Dr. Jones and the hospital send a bill for all Medicare-approved services rendered that are covered by Medicare Part A, hospital insurance, and Part B, medical insurance. Note: Medicare does not cover typical annual physicals, only Medicare wellness visits, which are different. Check with your doctor when scheduling an appointment. Next, Medicare Part A and Part B pay their share of the Medicare-approved services, based on Medicare assignment, that is, prices set by Medicare. Then your claims data goes to the insurance company that you purchased the Medigap policy from. Finally, the insurance company determines which Medigap policy or plan you purchased, A through N, to pay its share of the costs. Remember, there are 10 standardized policies or plans with different levels of coverage. So, what are these plans and what are the levels of coverage? These private insurance policies offer a variety of levels of coverage to cover the out-of-pocket costs not covered by Medicare Part A, hospital insurance, and Part B, medical insurance, as shown here. There are 10 basic Medigap plans, Plan A through Plan N. Each plan covers a subset of original Medicare out-of-pocket costs. 6 plans include foreign travel emergency benefits. The 2 most comprehensive plans covering the most out-of-pocket costs are Plans F and G. Plan F is no longer available to new Medicare enrollees eligible after January 1, 2020. That makes Plan G the most comprehensive, covering all Medicare out-of-pocket costs except for the 2026 Part B annual deductible of $283. Monthly premiums vary by plan and insurance company. Next are Plans K and L. They are designed to pay less as a percentage of the costs for Part A and Part B services until the maximum out-of-pocket limits are reached. That means you pay more out-of-pocket before the plans pay. After the maximum is reached, each plan pays 100% of the costs. It's one way to keep monthly premiums low. Finally, on the other end of the spectrum are the high-deductible plans F and G. They are designed with out-of-pocket deductibles of $2,950 in calendar year 2026. It means you pay all the out-of-pocket costs until the deductible is met. Then the plans pay 100% of the costs of all Medicare-approved services. It's just another way to keep monthly premiums low. To learn more about Medigap plans, visit the Medicare.gov website. In some states, you may be able to buy another type of Medigap policy called a Medigap Select plan. Select plans require you to use the insurance company's network of providers and hospitals to save money, but may limit your options. If you buy a Medigap Select policy and you're not satisfied, you have the right to change your mind within 12 months and switch back to a standard Medigap policy. In addition, Massachusetts, Minnesota, and Wisconsin standardize their Medigap policies differently. So, when can you apply for a Medigap policy? Medicare Supplement insurance policies don't have the same restrictions on when you can enroll like other parts of Medicare. As long as you're enrolled in original Medicare Part A and Part B, you can apply for a Medigap policy anytime during the year. However, an insurance company may ask you health questions to determine what level of risk you are. Health questions allow the insurance company to conduct medical underwriting to determine whether to offer you coverage at what price and with what exclusions or limitations. For example, insurance companies may refuse to sell you a policy or impose certain medical requirements based on your health history. If a company does agree to sell you a policy, you may need to pay a higher monthly premium and/or be subject to a 6-month waiting period before the policy will cover pre-existing conditions. So, what kinds of health questions can insurance companies ask? Here's an example of a list of health conditions that insurance companies may check for. Not all insurance companies ask the same questions. Health questions focus on the severity and duration of illness. Medical underwriting protects the insurance company's current pool of clients to help keep premiums low. The more claims an insurance pool experiences, the higher the monthly premiums may be in the following year. Remember, these are private insurance policies not subsidized by Medicare. So, when can you get a Medigap insurance policy without answering health questions? Federal laws require insurance companies to offer to sell you policies without asking health questions, but only during very specific situations. They are referred to as Medigap guaranteed issue rights. So, let's look at 6 examples. The best time to buy a Medigap policy is during the Medigap open enrollment period. This is your first guaranteed issue right. It happens during your Medicare initial enrollment period when you first turn age 65 after you enroll in Medicare Part A and Part B. The Medigap open enrollment period starts the first day of the month you turn age 65 and you're enrolled in Part A and Part B. This guaranteed issue period lasts for 6 months, during which an insurance company must offer you a Medigap policy without asking you health questions. The second guaranteed issue right is when you've worked past age 65 and your employer group health coverage ends. You may have already signed up for Medicare Part A, but delayed Part B because you had employer coverage. When your employer health coverage ends, you are eligible for a Medicare special enrollment period based on loss of employer coverage. Your guaranteed issue right period starts once you enroll in Medicare Part B. You'll have 63 days to buy a Medigap policy without answering health questions. You can even sign up for Part B and a Medigap policy while you still have employer coverage too. The third guaranteed issue right is called a trial right, that is, when you first became eligible for original Medicare Part A at age 65 and enrolled in Part B during your Medicare initial enrollment period. Then switch to a Medicare Advantage Part C plan instead. If, after you join a Medicare Advantage plan and it's your first time and you're not happy with it, you have a single 12-month period, your trial right period, to get your Medigap policy back. Only if the same insurance company still sells it when you return back to original Medicare. Your Medicare Part A, Part B, and Part C effective dates must all be the same. An insurance company must offer you a Medigap policy without asking health questions. The fourth guaranteed issue right, also a trial right, is when you've canceled your current Medigap policy to enroll in a Medicare Advantage Part C plan. If within the first 12 months, you're not happy with your Medicare Advantage plan, you can switch back if you buy the same Medigap policy you had before. The insurance company cannot ask you health questions and you can't be turned down. The fifth guaranteed issue right is when you've enrolled in a Medicare Advantage Part C plan, but then you move out of the plan's service area. An insurance company must offer you a Medigap policy without asking you health questions. The sixth guaranteed issue right is when you've enrolled in a Medicare Advantage Part C plan, then the insurance company stops offering the Advantage plan in your area, or no longer offers the plan. You'll need proof from the insurance company that the plan is ending. The last guaranteed issue right is when a person qualifies for Medicaid. Some states have additional guaranteed issue rights that extend beyond federal law. For example, some states have a birthday rule that allows you to switch Medigap plans starting on your birthday without asking health questions. Other states have year-round guaranteed issue rights to purchase a Medigap policy anytime during the year. Contact your state's Department of Insurance to learn more. So, how are Medigap insurance monthly premiums set? Each insurance company decides how it sets prices or premiums for its Medigap policies. The way they set prices affects how much you pay now and in the future. Each Medigap policy can be priced or rated in one of three ways. First, community rated, also called no age rated. Generally, the same premium is charged to everyone on the same plan, A through N, regardless of age or gender. Second, issue age rated or entry age rated. The premium for each plan is based on your age when you buy or issued the Medigap policy. Finally, attained age rated. The premium for each plan is based on your current age, that is, the age you've attained. So your premium goes up every year as you get older. So it's important to look at how much the Medigap policy will cost you now and in the future. Other factors such as where you live, medical underwriting, and discounts can also affect your premium. So what other factors affect prices? Some insurance companies may offer discounts, like discounts for women, non-smokers, or household discounts. Also, discounts for paying yearly or paying premiums using electronic funds transfer. Or discounts for multiple policies. Or medical underwriting to determine a different premium when you don't have a guaranteed issue right or aren't in a Medigap open enrollment period. Some insurance companies offer Medicare Select policies that may require you to use certain provider networks. If you buy this type of Medigap policy, your premium may be less. Some policies offer high deductible options for plans F or G. Some plans offer foreign travel emergency services and some offer fitness benefits. For more information about all available Medicare options, search for Medicare information at official government websites or your state's Department of Insurance. You can also contact your trusted state-licensed, Medicare-certified independent insurance agent for help. It doesn't cost any more to use an agent. Their compensation comes from the plans they represent. An agent can answer all your Medicare questions throughout the year at no additional charge.